Dr. Weinrach, double board certified plastic surgeon here in Scottsdale. I thought I'd discuss a little bit about all the different types of breast implants that are available, as that can be a confusing issue because there's so many of them. So everybody wants what's called gummy bear implants, and basically all of the gel-filled implants today are what I would call gummy bear type of implants. You can cut them all right in half and they'll maintain their shape. And I've demonstrated this in a different video which you can look at. Here is a Memorygel implant. This implant's been around a long time, and it's a soft implant, very natural feeling, but you can still cut it in half and it'll maintain the shape. This is a gummy bear implant. This is a newer type of Mentor implant. It's called Memorygel Xtra. And the difference is that there's a little bit less shell for the same amount of filler. The filler that's in both of these is the same filler. This one just has less shell, so it's more tightly filled than the original Mentor Memorygel. And as hopefully you can see on the video, it kind of wrinkles and ripples a little bit less. Here's the Memorygel Xtra, and here's the regular Memorygel. When it's upright, hopefully you can see, because of the tighter fill also, the Memorygel Xtra keeps a little bit more upper pole fullness than the regular Memorygels. That's not necessarily better or worse, that's a personal preference. Some people want more upper pole fullness in the breast, some people want less. So those are the two different types of Mentor implants. Then, another company is Allergan, and these are Allergan breast implants. So these are all gummy bear implants too, but the difference is with them, the shell is the same, but the thickness of the filler is a little bit different between all three of these. They have their basic one is an Inspira implant. The middle one is called Soft Touch, and then the most cohesive or thickest fill is the highly cohesive implant. So the highly cohesive one is the most firm, but it gives the most upper pole fill compared to the Inspira. Again, personal preference. Is Allergan better than Mentor, or Mentor better than Allergan? Really, again, it all comes down to personal preference. You have to come in and feel the implants and see them for yourself and decide. So the other issue that comes up is profile. What does profile mean? A lot of people come in thinking they want, well, I want a high profile implant because that's what my friend had. And that's not necessarily the best case. What's good for one person is not necessarily good for another person, and I'd like to demonstrate profile. These two implants are both the exact same volume. These are both 450 cc's. This one's a moderate plus profile, this one's a high profile. I think you can see the high profile projects a little bit more and is more narrow, and the moderate plus projects less and is a little wider. For larger size implants, probably a higher profile implant would be better for most people. But to demonstrate a smaller size implant, for example, a very small person who might want a 275 cc implant, this is the high profile, and look how narrow that is. I think for most people, a high profile 275 cc implant wouldn't be ideal compared to a more moderate or moderate plus profile implant. So a high profile 275 cc implant and a high profile 450 cc implant are two totally different things. I think you can appreciate two completely different diameters of the implant. So it really comes down to your anatomy, how wide your breast is, how wide your chest wall is, as to what implant would fit you the best. Lastly, for the gel implants, I'd like to talk about shaped implants. Some people think that they want a shaped or anatomic implant, and what these are already have less fill in the upper pole and more at the bottom of the implant. Some people think this is a more natural type of shape. But the thing to keep in mind is, even with a round implant, when you're upright, you can see that round implant really takes on a shape type of implant also. There are some disadvantages with the shaped implants. As you can see, the shell is textured compared to a smooth type of shell implant. There are certainly some disadvantages that go along with textured implants, which we can discuss in a consultation. The other thing is, with a shaped implant, if this rotates at all after it's in, that's going to look really bad, and the only way to correct that would be surgery. A round implant can rotate all at once and it doesn't matter because it's round. So for that reason, round implants, in my opinion, are best for the great majority of patients. Okay, and last, there's saline implants, which I've talked about before, but this is a regular old-fashioned saline implant. This is just a shell, and it would get filled with salt water, and it has kind of a water balloon type of feel. Certainly the least expensive option, but also the least natural feeling type of implant. This is also a saline implant. This is called, the brand name is the Ideal implant. It's saline, but it has some silicone shells on the inside to give it some structure and help it hold its shape. These do feel a little bit more natural, or I should say a lot more natural than a regular saline implant. Probably not quite as natural as a gel-filled implant, but it is very close. So hopefully that clears things up a little bit with the implants. Again, the best thing to do is come in and get measured, have a consultation, and you can feel all of these different implants for yourself and look at them, and that's really the best way to decide. So look forward to meeting you, and let us know if you have any questions. Give us a call. I'll take great care of you. That I can promise you. Thanks for watching. Appreciate it.